The Centers for Disease Control estimate that 2 million people worldwide do suffer from hospital-acquired infections. 100,000 of these people do die. Did you know improved hand hygiene compliance with the use of alcohol-based hand rub can reduce these infections by 40%? Well, while alcohol-based hand rub and soap and water are both readily available and used in healthcare facilities in high-income countries, healthcare facilities in low-income countries often lack these basic necessities. Markedly, commercial alcohol-based hand rub is often very expensive and not locally available. The Infectious Diseases Institute with other stakeholders implemented a low-cost intervention to locally produce and distribute quality-controlled alcohol-based hand rub to healthcare facilities using a district-led approach, starting in the 2 districts of Western Uganda and scaling up to 2 others to enhance the COVID-19 response in border districts. We do appreciate this map. Looking at the western part of Uganda, the first district in green is Kabarole, the second one is in Kasese, where the project started. Because of the good results, it has been expanded to Amuru, the northern part of the country in green, you can see, and also to Tororo in the eastern part of the country. These 2 are soon kickstarting. This approach is the first of its kind world over. The Infectious Diseases Institute worked with district stakeholders to identify alcohol production units. IDI trained district staff to ensure sustainability, adopting the WHO protocol. Internal and external quality control of the alcohol-based hand rub is performed using an alcohometer. The alcohol-based hand rub is packed in a 20-liter jerry cans after branding. For the model to be cost-effective, distribution is done using the National Medical Stores push system, or sometimes with the help of the DHO's office. At facilities, the alcohol-based hand rub is quoted into 1-liter bottles and 60 milliliter spray bottles. We do appreciate this figure where the staff of IDI at Kasangati alcohol-based production unit doing some great work. In figure 1, these are the liters that have been produced at these different sites. 3,800 liters at Kabarole. This is in the span of Jan to December 2020. Kasese 4,320 liters, and then Kasangati 3,840 liters. Great achievements have been recorded since the start of this project. 156 healthcare facilities in Kasese and Kabarole have regular access to the alcohol-based hand rub. Using a district-led approach, alcohol-based hand rub production and distribution has been successful. 100% of all the alcohol-based hand rub batches produced passed both internal and external quality control. 2 district staff in Kasese have been trained on the local production of the alcohol-based hand rub and currently take charge of the production unit. Training for the Kabarole staff is ongoing. The alcohol-based hand rub has been certified by the National Drug Authority of Uganda. We therefore conclude by saying that a district-led approach at a single production unit for the entire district or region enables primary healthcare facilities which lack the space for a designated production unit and rarely have the cadre to support production have the access to the alcohol-based hand rub regularly. We do recommend through advocacy to the Ministry of Health to enable districts to locally produce alcohol-based hand rub sustainably for both health facilities and community location through provision of raw materials by NMS. We do acknowledge the Global Health Security Department at the Infectious Diseases Institute, the CDC, IRC WASH, districts, local government stakeholders for the great support they have put to see this project a success. I'm Fred Tusabe on behalf of the team, a WASH project officer at the Infectious Diseases Institute. Thank you for listening to me.